Welcome to all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn, and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is typhoid fever. Introduction. The other name of the typhoid fever is enteric fever, slow fever, gastric fever, abdominal typhus, slow fever, infantile, remittent fever, nervous fever, pathogenic fever, drain fever, and low fever in the different textbook. It is written. Only humans can be infected. No known animal reservoir of the typhoid fever. Typhus is a different disease having similar symptom, and typhoid means resembling typhus. In the past, typhus was the disease. Later on, typhoid was diagnosed. So, the typhoid fever, as one can see, having this white coating on the tongue and Salmonella typhi get entry through the water or the contaminated food into the body, and that lead to the rash on the body like rose spots, and large liver and spleen is there, and there are ulcers in the intestine, and the ulcer in the intestines are transfer, as the name is typhoid. T stand for, so there are transfer ulcers in the intestine. That is a recognition point during surgery also. So it is an infectious feverish disease caused by the bacterium Salmonella typhi and less commonly by the Salmonella paratyphi. It causes gastrointestinal infection of the Salmonella enterica typhi. The bacterium withstand both drying and refrigeration. It is acute generalized infection of the reticuloendothelial system, intestinal lymphoid tissue, and the gallbladder which are involved. Symptoms are fever that starts low and increases daily, reaching as high as 104.9 Fahrenheit or 40 degrees centigrade. It is a step ladder fever. The fever increases daily, and there is headache, weakness, and fatigue, muscle aches, and sweating is there. So here one can see the person is seriously ill, lying on the bed, having abdominal discomfort and the pain, and sometimes diarrhea or the constipation with the headache, malaise, or weakness. So these are the sign and symptom of typhoid. Patient is having dry cough, loss of appetite, weight loss, stomach pain, diarrhea or the constipation, and the rash on the body. There is swollen stomach due to that is enlarged liver or the spleen is also enlarged. Usual onset is 1 to 2 weeks after ingestion of the bacteria by any way. Duration is usually 7 to 10 days after the antibiotic treatment begins. Longer if the complication or the drug resistance is there. Disease is preventable by the vaccine, and the travelers to the endemic regions are required to get a vaccination before travel so to avoid the infection. Now here one can see the patient is lying down due to malaise and fever, and the other patient is having the complaint of the abdomen because it is enteric fever and it is the disease of intestine. Treatment is antibiotics, hydration, surgery in the extreme cases when the perforation is there, the multi-drug resistant called MDR and extensively drug resistant XDR is seen in some countries, and prognosis is mostly patient recover without complication if diagnosed early and proper antibiotic given early. If infective strain is MDR or XDR, prognosis is poor. 2 to 5% will become chronic typhoid carriers. Salmonella restricted to the certain animals such as cattle and pigs. And if infect humans, it is invasive and life-threatening. The salmonella which infect the human can be very dangerous and serious in case of human involvement. Now, epidemiology, typhoid fever occurs as endemic and epidemic. Disease occurs at all age group, but probably most common in 5 to 20 years of age group people. The disease is most common in India. Children are most commonly affected. Typhoid decreased in the developed world because of the improved sanitation and the use of antibiotic. In the last year in the USA, there were only 500 cases of the typhoid. Now, without treatment, risk of the death is as high as 20%, and with treatment, it is about 1 to 4%. There are two factors which have epidemiological significance. First, an asymptomatic human carrier state, that is, 3% of the persons infected with the staph typhi carrier state goes into the carrier state that lasts many weeks to years. Children are rarely become typhoid carriers. And the second epidemiologic significant factor is use of the antibiotics in the animal feeds and indiscriminate use of antibiotics in humans that increases antibiotic resistance in salmonella by promoting transfer of the R factor, which is responsible for the resistance in the bacteria. Now, the cause of the typhoid fever is typhoid bacillus, belongs to the family Enterobacteriaceae, which is a close relative of E. coli bacteria. It is a gram-negative straight rod, non-capsulated, non-sporing, non-acid fast. It measures 2 to 4 micron meter in length and about 0.6 micron meter in width. Mostly fimbriated means contain fimbria, and it is a flagellated bacteria, so it is motile by peritracheous flagella, the flagella which are all around the body. So here one can see the structure of the salmonella. Here in the center is the DNA, then there are the plasmids, and these are the peritracheous flagella which are rising from all surface of the body, and that these are the ribosome, cytoplasm, pili or the fimbriae, then the capsule and the cell wall and plasmolemma, and these are the parts of that. And here there is the antigenic structure of the bacteria. These flagella, these are the containing H antigen and VI antigen, that is from the surface antigen, and O antigen, which is the somatic or the body antigen. Now there are certain risk factors for the disease. People not to have access to the clean drinking water, and with poor sanitation, drink water is polluted by the sewage that contains Salmonella typhi, and the people are exposed to the contaminated food, and living in or travel to the area where typhoid fever is endemic is also a risk factor. Working as a clinical microbiologist and handling the Salmonella typhi bacteria and have close contact with someone who is infected or has recently been infected with the typhoid fever. These are all the risk factors for typhoid fever. Now, what is the infectious dose of these bacteria? About 100 to 10,000 bacteria ingested via contaminated food or the water are responsible for causing the disease, much lower if the stomach pH is raised and much lower if the vehicle for the infection is chocolate because it protects the bacteria in their passage through the stomach, and infectious dose of about 100 bacteria is most of the time sufficient to cause the disease. The life does not require that we be the best, only that we try our best to be the best, and it is the dream of everyone and the desire of everyone to look like and to behave like the best. Now, the transmission and the spread of disease is mainly by the contaminated with feces of an infected person, so that is fecal oral route. Three main ways of the spread of disease are contaminated water, contaminated food and animals, and the carrier stage from person to person. So the number one, contaminated water. This is a very common cause, and water contaminated with the human feces which contain salmonella. Now, number two is contaminated food and animals. Food contaminated with the human feces, food incompletely cooked and carry the bacteria. Contaminated food usually handled by an Salmonella typhi carrier or by infected milk and ice cream made with infected milk products. Foods like fruits and vegetables washed with infected water and ice containing Salmonella bacteria, and by contaminated meat and poultry can follow direct contact with the infected animals like farm trip reptiles as the pets, and the salmonella has been seen in the eggshells also. Now, third transmission factor is carriers, mean person to person. 3% of the people who are infected with Salmonella typhi, they become carrier, and they are asymptomatic human carriers, means still excreting typhoid bacterium after the acute stage. Carriers are of the following three types: convalescent carrier, that is just patient has recovered from the disease and they are capable of transmitting the disease from 3 weeks to 3 months. Then temporary carriers, these are having more than 3 months and less than 1 year period to spread the disease. Then there are number three, the chronic carrier, which are having the bacteria for more than 1 year. These all continue shedding bacteria in their feces, all the carriers, convalescent, temporary, and chronic carrier. Now, what is the pathogenesis of the disease? Pathogenic Salmonella bacteria ingested survive passage through the gastric acid barrier, and they now invade mucosa of the small and large intestine and produce toxins. This stimulates release of the pro-inflammatory cytokines which induce an inflammatory reaction. So the toxins are produced by the bacteria which stimulate the cytokine. This causes diarrhea and ulceration of the mucosa. More serious infections occur in infants and adults over the age of 50 and the debilitated subjects with immunocompromised immunity. Bacteria multiply in the phagocytic cells of the pyre patches of the ileum, and here one can see the epithelium, and here there is lumen of the bacteria, lumen of the intestine, and here one can see from the lumen the salmonella is going to cause the invasion, and from here these bacteria go to the other cells, and that is just going to have the localization to the cytosol, and there is the multiplication or hyperreplication of the bacteria, and the cell exclusion and pyroptosis, and that is going to just release the cytokines, and then there is the clearance of the bacteria or the reinvasion of the bacteria to the new host cells, and that lead to the shedding, and ultimately by these mediator there is inflammation causing all the problem. And here one can see the pear patches who have been invaded by the bacteria, and there are ulcers there which are usually the transfer ulcers, as I have already told you, that is T for transfer and T for the typhoid. Now, pathogenesis, bacteria cause secondary bacterium and results in the spread to the other organs. Liver, spleen, and the lymph nodes are involved. Here they do have intracellular survival and the growth. Bacteria can go to the mesenteric lymph node to thoracic duct, and now from the thoracic duct they are going to enter the bloodstream, causing the systemic disease. Some enter about 40% to the gallbladder and become the chronic carrier. Here one can see the intestinal lumen containing the bacteria, and these bacteria are just going to invade the epithelial cells, and these are not capable of infecting usually, but these are able to infect the M cells, and here they are going to get entered into the M cells, and ultimately they are coming to the submucosa, and here they multiply in the phagocyte, and then they are capable of invading the other nearby cells, and here there is dendritic cells that is also capable of giving shelter to the bacteria and the multiplication of the bacteria. So the tight junction does not allow the bacteria to pass from here, but they can just enter the epithelial cell and can reach to the base of the cell. So here the pathogenesis, ingestion by, lead to the stomach stay and then to the small intestine. These are going to have the invasion of the small intestine, and then the phagocytes are capable of giving shelter, and these bacteria can hide in the mesenteric lymph node. They can go to the liver, to the spleen, and intracellular survival, growth, and dissemination is there. As I have told you, they are capable of surviving the live in intracellular, and now they are able to reach to the gallbladder to become chronic carrier, or they can go to the blood, causing the bacteremia and the systemic involvement of the different organs of the body. Through the blood, they can reach anywhere. Now, the typhoid fever is said to be the king of actor on the stage of diseases because it mimics with many diseases and dodges the clinician by giving its different symptoms which do have the mimicry with the many other diseases. So it is called king of vector on the stage of disease. Also called typhoidal salmonellosis. Still epidemic in many of the developing countries of the world. Reasons: carrier has infected a static water supply like ice cream or some other food. Typhoid bacilli can live for many years in the gallbladder of the patient after an attack of typhoid fever, even after the death of a carrier. The frequency of the air travel and the patients returning from tropics and the subtropics, which are the endemic area of the typhoid, the diagnosis is missed and effective treatment is delayed, and prophylactic immunization still not fully effective. These all lead to the typhoid fever. Now, what are the signs and symptoms of the typhoid fever? For convenience, it has been divided into 5 parts. These are the first week, second week, third week, fourth week, and fifth week. In the first week, which is also called hyperplasia stage, here there is swelling of the lymphoid tissue plus proliferation of the macrophages with the typhoid and salmonella bacteria, as they are capable of survival intracellular. Body temperature rises slowly. There is relative bradycardia because it is a rule with 1 degree rise of temperature, there is increase of 10 heartbeats per degree centigrade. But here there is relative bradycardia, which is called faggot sign, and there is malaise, and the headache means the pulse is not as rapid as it should be at 104 degree temperature usually. The patient have cough, bronchitis, bloody nose, sometimes epistaxis, the seen, and abdominal pain is there. There is decreased TLC, white blood cells, so that is called leukopenia, and with eosinopenia, decreased eosinophil, but there is relative lymphocytosis. Lymphocytes are more. Blood cultures are positive. Vidal test is negative at this stage, first week. There is anorexia and the coated tongue has been seen. And here the symptoms of the typhoid fever: high fever that increases consistently, so that is called stepladder fever. Then there is the constipation, headache, stomach pain, or the discomfort, and this is the coated tongue, which a good smart clinician can recognize it is because of typhoid fever. Now comes the second week. It is called necrosis stage week. There is necrosis of the swelling lymph node or the solitary follicles. Person is too tired to get up and very weak now. High grade fever shows stepladder rise with nausea and vomiting. Relative bradycardia, that is, already I have told you, sphygmothermic dissociation or the faggot sign with the dicrotic pulse wave. The heart rate is not as much increased as it is usually seen with other kind of fever. 1 degree increases 10 beats per minute. Patient have delirium and patient is often calm. Give typhoid nickname the nervous fever, sometime agitated patient. Rose spots or rash seen on the lower chest and abdomen in 33% of cases. So the patient is having headache, eye pain, fever, and rash, red spots. And here one can see the rose spots of the red rash, and then the patient have back pain, muscle aches, and the joint pain, which are seen in second week. Patient also have the rhonchi, rattling breathing sounds in the base of the lungs, abdomen is distended and painful with a rumbling sound. Diarrhea may occur, but the constipation is more common as the patient has not taken anything rough or fiber, so the constipation is more prevalent as compared to the diarrhea. Spleen and the liver enlarged, called hepatosplenomegaly, and these are also tender. Liver transaminases are elevated when all test is strongly positive at this stage. Blood, urine, and stool cultures are still positive. Now, the third week, the third week is called ulceration stage. A number of complications occur. The fever is still very high. Dehydration is there with malnutrition. Patient is delirious. Intestinal hemorrhage due to the bleeding in the congested pear patches, and intestinal perforation in the distal ileum is a serious complication, and sometimes it is very fatal also. It occurs without alarming symptoms until septicemia or the diffuse peritonitis sets in. Respiratory disease like pneumonia and the acute bronchitis is there. Encephalitis, neuropsychiatric symptoms, muttering delirium, or the coma vigil is there with pickering at the bedclothes or the imaginary subjects. These are the neuropsychiatric symptoms seen with typhoid. So, patient has high fever, headache, weakness, dry cough, stomach pain, constipation, or the rashes, which is now most of the time apparent. Now, the metastatic abscess in third week and cholecystitis, endocarditis, and osteitis has been noticed. Low platelet count, thrombocytopenia, shedding of the bacteria in the feces, making the chronic carrier stage. Now comes the fourth week. It is the stage of healing or defervescent stage. Fever and the most symptoms resolve. Fever comes down and gradual improvement in all symptoms and the signs is there. So that is called defervescent or healing stage. And the fifth week, convalescent stage, there is disappearance of all the symptoms which have been seen in the last 4 weeks.